Good afternoon and welcome to this webinar all about the British Red Cross programme around connecting communities and tackling loneliness. My name is Richard Taunt.
I'm Kate Jopling.
And I'm Olivia Field.
And over the next 59 minutes, we're going to be running you through an introduction to the programme, an introduction to the learning events coming up, and all about how you can get involved. So we're going to have some presentations for probably about 20 or 30 minutes, but the heart of this webinar is a discussion. And so would really appreciate your comments, questions, reflections as we go through, which might be just about some of the practicalities about what on earth this thing is and the events coming up, but also some of the topics which you are dealing with in your day-to-day jobs, which you would like to be addressed in the events. So let's just run through how you can get involved today. So 3 ways where you can join the discussion. So first is to use the Ask Question feature on GoToWebinar, which should be there on your screens. If that's proving a bit tricky, do feel free just to drop us an email, hello@kaleidoscope.healthcare. Or if you're a tweeter, please do tweet. The snappy hashtag is connecting communities, all one word. So please do tweet as we go along. And if everything goes wrong mid-webinar, don't panic, it's okay. We're recording today, and so we'll be making the recording available shortly afterwards, so that you can watch it back, but also share it with all of your friends and family who may be interested at a later point to talk and hear about the programme which is going on. So I think before we dive into what the programme is, Kate, I think you're going to talk us through. Just say today's webinar is being hosted by Kaleidoscope. We're a social enterprise set up to bring people together to improve health and care. And one of the ways to do that is through events like today. I'm very pleased to be working with British Red Cross with Co-op in order to do this. So we're all good to go?
Perfect.
Kate, do you want to start us off?
Okay, so I'm Kate Jopling. I'm a policy and strategy consultant, and I've got a particular interest in learning loneliness. And I'm going to be working with Kaleidoscope to deliver these events. And I want to talk a little bit about just the background to the events, the context of the kinds of things that we want to share learning around. So the starting point for all of this is the British Red Cross and Co-op partnership, which they have a strategic partnership to work on loneliness together. It's the Co-op's largest ever charity partnership, and they've raised over £6 million to work on loneliness in a range of ways. And that includes research on loneliness, it includes advocacy, and also new services. And it's those new services that we're going to be talking about today and that we want to share learning around through this programme. So, piece of research that the Red Cross and Co-op partnership kicked off with was called Trapped in a Bubble. You should have a look at it. It's a great piece of research. And that specifically looked at the impact of life changes and transitions on loneliness and the way in which changes in our life create risk of loneliness because they break our connections and they break our sense of identity. And so the Co-op and Red Cross worked together to develop a Connecting Communities programme and a series of new interventions which try to address that disconnection in people's lives. So these services are community connectors, and they've been made available in communities up and down the country. There are 39 community connector services, and they are delivered by teams of staff and volunteers working together. So aiming for a ratio ultimately of 1 member of staff to around 10 volunteers to deliver these services available to all adults, specifically to people who are at risk of loneliness or experiencing loneliness in their lives. It's a really significant programme, a really significant expansion of this kind of services. So what is the service? What does it do? The Community Connector programme, Connecting Communities programme, is aims to be around a 12-week intervention, and the aim is to help the individual ultimately be independently connected to their community, and that's done through a conversation about what is important to the individual, what matters to the individual, which leads to the setting of some goals for that individual to work with their community connector and the team of volunteers to support them to make the connections that they want into the community, to access services and support, to access the things that will help that individual achieve their personal goals. Because as we know, loneliness is a very, very personal experience, and the solutions therefore are very, very personal. So the Connecting Communities programme has hugely increased the number of these services available in communities. There's lots of learning being generated by that programme, and the Red Cross wanted to share that with people who are involved in delivering these similar sorts of services. So when we say similar sorts of services, what do we mean? So a little while ago, I produced for the Campaign to End Loneliness and Age UK a framework for looking at loneliness interventions. And I think if we think about the kind of intervention that the Community Connect programme is, it very much sits at the top of this framework of interventions, which hopefully you can see at the moment, at the top where we're talking about foundational services. So community connectors are not befrienders, they're not lunch clubs, they're not the kinds of things that people ultimately integrate into to have their loneliness alleviated. They're not the activities that people join where they meet new friends. They are the way in which people are identified and supported into that ultimate new form of connection. So they provide that level of understanding and unpacking of the issues that people are facing so that we can identify the individualized solution and the support that people then need to rebuild their confidence, their capacity to really engage in their communities. So that's where they would fit in the spectrum of loneliness interventions. But the reality of these interventions is they're very much holistic. They're not about saying, here's a loneliness service for a lonely individual. They're about addressing people's needs in the round. And that means they have a lot in common, not just with other loneliness services, but with a whole range of services which take this same approach. So we, in trying to think about this programme of shared learning, have been trying to kind of unpack those key features. And we've come up with kind of these key areas. The services that we want to share learning with are targeted services. Generally, they're targeted in lots of different ways. They might be targeted, as the Red Crosses are, specifically on people who are at risk of experiencing loneliness. They might be targeted on a particular locality or delivered within a particular community. Or they might be targeted on people who have a set of health conditions or perhaps have gone through personal circumstances like bereavement. There's a whole range of these services. But the key features that they share is that they are one-to-one support, that they offer a kind of person-centered and holistic approach. So what matters to you, not what's the matter with you, that kind of approach. And that they are not necessarily focused on loneliness, may not even have loneliness anywhere near their title, may not necessarily even see that as their primary focus, but they offer that support in the round, which includes recognition of people's personal relationships and the other things that matter to them in life. And then the final point about them is that they try to connect people back into the communities. They aim to foster independence ultimately. So they may not have a time limit, but they have a beginning and an end. So that's the kind of services that we are talking about. And so when we've been thinking more and more about what the value of sharing learning between these services would be, we've been also trying to think about, well, where are the common themes that we are seeing emerging across when we look at the literature around these services, when we talk to people who are working in these kinds of services. I think there's a lot of learning simply about what works well and what doesn't. There's a lot that people can share about the kinds of challenges they're facing, what they find is helpful in terms of connecting with other services in the community, what they found is helpful in terms of making links, working, getting these things off the ground even. There's lots of learning around how long it takes to work out these kinds of services. So we want to talk about what works well, what doesn't work so well, what challenges that we're all facing that we haven't been able to overcome. And we think there are probably three key things that will definitely be of interest to all of these services. The first is this critical thing about referring and outreach. When we're talking about services which are for some of the people who are most isolated, most vulnerable in the community, finding the right people is a very challenging problem. And some people find that their services are overwhelmed, and some people find that they struggle for referrals. We want to talk about all of that and unpack some of the issues. What have we done? What's worked? What can we all learn from each other? How do we avoid making the same mistakes over and over again? The whole point about this conversation, this guided conversation, this goal-setting conversation, this motivational interview, there's a whole range of different techniques that are used in this. But what can we learn from each other? What are the common features that we're all sharing across our different programs? Even though we all might see our methodologies as quite distinct, what's common? Do they actually all boil down to something similar? How can we pull out those golden threads between them? And then I think there's also a really interesting issue that's coming up in different communities, from one community to the next, about what is the nature of the community in which we're connecting people? Have we seen declines in the kind of services people need? Are there gaps where no one has got anywhere to refer people into? So what can we learn from each other about those issues, and how have they been resolved? How could they be resolved? And what's the the space for advocacy in this area. But I think the critical thing to say is that whilst we think those are some of the things that will come out, the nature of these learning events is going to be unpredictable, and we really want to hear from people with different experiences. Some people have been running these schemes for years, some people are really new into it, some people are just starting out. We want to share learning across all of those and find the themes that we haven't yet identified, that the literature hasn't yet identified, that people don't yet know about, and pull all of that together, because I think through that we'll have a stronger whole.
Okay, thank you very much indeed. So just to check my understanding, that there's this whole range of these services across the UK, including the Red Cross services, but this whole range.
Yes.
I think, as far as we know, this sort of event hasn't happened before.
No, we don't think so. Otherwise, we wouldn't be suggesting it's a good idea. But I think it is really important that we start to pull together those threads. And there is so much similarity. And I think in some localities that's starting to be recognised, that a lot of these programs have common aims, common goals. They're doing similar things. But I think we can bring that out more strongly, and as a result, tell a stronger story across all of them about what works and what doesn't. And
a really interesting thread just in terms of this evidence-based building, and possibly we're at a point now where we're able to have these events where we wouldn't have been even just a couple of years ago.
We've seen huge growth in social prescribing schemes, in local area coordination, in community link workers, all of these kinds of programs which we think share common themes, common goals, common ways of working, that I think there's now a really good time to bring this all together.
Okay, thanks very much. And so those three particular issues we bring out there around referrals, about having the right conversations, about what's available in communities. You might be doing that classic webinar thing, which I do, when you're on a call where you're sitting there nodding furiously, nodding exactly at whom is always the question, but you might be nodding going, yes, exactly, those are the issues which we're dealing with in our service. Or there might be a whole host of other issues which you'd like to get into. Either way, again, do just get in touch. You can ask a question, send us an email, hello@kaleidoscope.healthcare, or tweet connecting communities. We'd love to know whether sort of our assumption about whether those are the right issues is right. We are planning the events as we speak, so your feedback would be much appreciated. Olivia, these events, are you going to talk us through it?
Yes, so I'm Olivia Field from the British Red Cross, and I'm leading on the British Red Cross and Co-op Partnerships loneliness policy and advocacy work. So the bulk of my work is around making sure that the Jo Cox Commission on Loneliness final calls to action are driven forward as meaningfully as possible. And that includes carrying out new research, plugging gaps in research in our evidence base, developing policy and practice solutions across the board by convening with stakeholders from MPs to people who have experienced loneliness, to charities, businesses, civil servants. And of course, a bit of work that I'm really excited about is this shared learning piece. So effectively, this is all about bringing people together to improve the delivery of our own community connecting services, but yours as well, so that we can just better help people who are lonely or at risk of loneliness. At the Red Cross, we've been heartened to see the positive impact that our community connecting services have had on really quite a range of people throughout the last few months, or a bit longer than that. But at the same time, we know that we've still got much to learn. So like many services that tackle loneliness and social isolation and beyond, there's a lot to learn. Kate's touched on some of them already. So how to ensure appropriate referrals inwards and outwards, how to continue providing person-centered care, how to do that in the first place, but how to continue doing that as capacity grows. All of these things are issues that I know we're not alone in facing. And so far, we've got a lot of learning to share with others, but we are fully aware that we've probably got a lot more to learn from others as well. Like yourselves, we know that some people have been providing these services for far longer than we have. So personally very excited about it. I know that our partnership is too. So effectively, it's a really practical way to improve the way that we tackle loneliness and social isolation across the UK. Simple idea, getting people together, sharing learning, sharing experiences, so that we can really start to tackle this issue. Specifically, we want to bring together those people involved in delivering services which share the key features that Kate's already touched on, we'll touch on again to emphasise it. We want to enable service providers to learn from one another, and we want to help identify common challenges, share solutions, and importantly, we want to use this to offer solutions to the wider community. So whether that is civil servants, funders, commissioners, or other providers like ourselves, and all so that we can help deliver better services for people who are lonely. So who can join? Lots of services, like Kate has already touched on, function like our community connecting services, and we effectively want anyone with experience of providing or delivering services that entail those core features. So one-to-one support, person-centered care, with the aim of building independence by connecting people into activities and communities and so on. And one thing to really emphasize is it doesn't matter kind of what level of seniority you are, whether you're a service manager, volunteer, service user, if you have got something to share, learning to share in the workshops, we want you there. That's pretty much the only criteria. So who can join? So we touched on some examples. We keep saying services that are like community connecting services. Well, ultimately, you can keep thinking about those core features, but some examples that came to our minds were mentoring schemes, community link workers, social prescribing schemes, local area coordinators. And part of the aim of this whole project is to really deepen our understanding of what interventions work and for who. And we want to make sure that we kind of collect that learning about a whole range of different people, all ages, all backgrounds, going through different life transitions, etc. So we've named a few possible client groups that you might have experience about, from care leavers to people with mental health issues, disabled people, older people, and so on. So how to actually get involved. So we'll be holding 3 learning events. The first one is in Bristol on the 20th of April. And our intention is really to have people from both Wales and the Southwest there, although if you happen to want to come to Bristol from anywhere else, please do come too.
It's a very nice place.
It's a very nice place, yes.
Yep.
Love Bristol. And the next one will be in London on the 27th of April, and then Glasgow on the 1st of May. And if you can't come, please just, and you've still got learning to share, just let us know by emailing hello@kaleidoscope.healthcare, and that email address is on the slides. And then we will be putting everything, all of our learning together in a final report that we'll share in the summer. And that will be shared with policymakers, commissioners, funders, providers, and also hope to feed it into several other initiatives that the British Red Cross and Co-op have going on. So we're providing the secretariat to the new all-party parliamentary group on loneliness that will continue to look for policy and practice solutions, and also convening the loneliness action group that brings together over 40 different key stakeholders from public sector leaders, charities, businesses, and so on. So all of this is about developing policy and practice solutions so that we can make the kind of new enthusiasm for loneliness as meaningful as possible. And I see this as a core part of that.
Great.
Finally, if you do come along, what you should expect. We should expect to hear from people involved in delivering community connector schemes and, of course, programs similar to them. You should expect to tell us about your experience. We really want to hear what it's like in practice. So while technical evaluations are hugely important in the whole across the board for loneliness and social isolation interventions, this is not about technicalities. This is very much about people's practical experiences, just what they experience, what they're seeing on the ground, and close to it. And finally, you should expect to meet people who you can learn from and who want to learn from you. So I look forward to seeing you there.
Olivia, thank you very much indeed. I think we should have some sort of tape we cut or some sort of a flurry of confetti, shouldn't we? But I think registration is now open.
It is. Brilliant. So,
and just clicking on that link. So those 3 dates again. Olivia, let's just pop back. 20th of April in Bristol, 27th of April in London, 1st of May in Glasgow, and I think those are all 10 till 1?
Yes, 10 till 1, and exact locations to be confirmed.
Location very, very shortly. Olivia, thanks very much. Really, really good run through. So just say again, we'd love your questions, reflections, comments as we go. Let's just remind you just how you can quickly do that. So again, you can use that Ask Question feature through the GoToWebinar software. You can send us an email, hello@kaleidoscope.healthcare, or do tweet us using the hashtag connectingcommunities. So we'd love your comments as we go through. But Olivia, just to talk about sort of British Red Cross's role in it, a really interesting set of links that you've got. So the purpose of this work, both being to connect up learning across people running these schemes, but also to influence or to support how you influence others.
Exactly.
So sort of the outputs sort of going in a range of different directions.
Yeah, exactly. I mean, this is it kind of all comes together, isn't it? There's such an appetite to tackle loneliness and social isolation. And in many ways, we do have the solutions, but I think we've still got a lot to learn. We need to start kind of reflecting on what we already think are the solutions. Yes. So I think, you know, community connecting schemes are relatively well evidenced, but there's definitely more to learn and to improve on.
Yes.
And as we look for solutions, you know, you can't separate it from the interventions that yes. will have to be available for people who are lonely or at risk of loneliness. So I see it all connecting. It's very exciting.
Yes. but again, these are the first events of their type. So if you're sitting there being excited, well, join the club. We hope to see you at the events. And just to make the point again, this is not British Red Cross saying we've solved everything.
No,
it's fine.
No.
Just to be clear.
Exactly. Yeah.
So in terms of what people are, you're going back to your expectations, it's about sharing what people have learned, but also it sounds very much like sharing what people have learned that they don't know or don't have the answer to.
Exactly, and we're going to come, and some people will have, you know, a great solution. Individuals always find their own solutions locally, don't they? And it would be great to start sharing that. And I think together, if we start sharing kind of, oh, well, this kind of worked, this didn't work, we can kind of piece the pieces of the puzzle together and start coming up with some kind of common threads and some themes to start tackling it. That no, by all means, we do not have all the answers, and that is why we're so passionate about this type of event. And I'm sure that other people have lots of answers, but I'm sure we all face the similar kind of problems. So
lovely. If you're sitting there and you think, well, I've cracked it, well, please come to the event and share your learning. That'd be great. Again, please do send through questions, comments. We'd love to hear from you. Kate, just going back to your point about the types of services we're interested in. Let's get that slide back up again. So this is not just about schemes for the elderly or particular client group. We're interested in a particular type of service. Do you want to go back over just those key?
Yeah, that's right. I mean, I think some of these sort of holistic person-centered interventions, to use loads of jargon, which I'm not a big fan of, but they've been around for a long time with different client groups, and I think they are spreading across. And actually, using this sort of approach as a way of tackling loneliness wasn't probably the first place it started. But I think what we're particularly interested in is services which provide one-to-one support to somebody that sits down and works with them about what the issues they face are. Obviously, it won't be relevant to the programme if you don't take any attention of people's relationships, but what we know is that when you start from what matters to people, relationships, social connections always come through to the fore, and they come through whether you're working with people with learning difficulties, whether you're working with people with mental health issues, or whether you're working with care leavers. These are critical issues. You will probably also be working on housing, benefits, and lots of other complex issues too. But it's that sort of core of this person-centered approach that says we recognise that what matters to people is very individual, the solutions are individual, and that people will need support to access those assets in the community and to make best use of what's available, and recognises that that isn't something that happens overnight, and it's not just about signposting or saying, look over there, here's a leaflet, but these sort of services which provide that core of understanding and support to enable people to be more independent, including around their social connections.
Lovely. And so if people are trying to think, how do I compare against those four? Should I come along? Benefit of the doubt, okay, probably be come along.
Absolutely. I mean, I think, you know, there are lots of programs, I think, that have some of these features, might not have all of those features. And I think, we'll still have things that we can learn from one another. I mean, certainly I would say if you don't think you are a loneliness service, that doesn't exclude you from this, because there are lots of the services that I've come across which started from a perspective of improving health outcomes or improving educational outcomes, which have huge amounts to show traditional loneliness services. So that's definitely, not critical, but equally, I think if you feel that you could learn from this community, come and give it a try.
Excellent, great. So just a reminder, please do send in questions, comments. A question through from Annika. Annika, thank you very much, from Host Nation, saying we're a new intervention in this area of tackling loneliness, but specifically refugees. Very interested to know if there are others working in this space. So first question, Olivia, does this fit within our brief sort of service we'd like to have at the events?
Yep, absolutely. The Red Cross also helps lots of refugees and asylum seekers, not specifically on loneliness, but we know it's just hugely important. I mean, you know that people who are lonely are more at risk of loneliness when they're going through transitions, and what bigger transition to kind of flee your home and leave your family and friends. So we hope to see people who are helping refugees there, so that we can learn for that group too.
Excellent. And Kate, how big a sector is this? Lots of people running services like this?
For refugees, I don't know the answer. I've come across one or two smaller refugee focused kind of mentoring programs and one-to-one support programs, but I don't know how many there are out there, but certainly it'd be great to connect those that are working in this area, because obviously there's some common issues and probably some very specific issues as well. But it's an area of growing interest. I mean, just the other day I was talking to some people from the States, and this is an area they're seeing as a key area for loneliness work. So lots of interest.
Lots to get into. And that point about common and specific issues, I think is a really important one, okay? Because we're not saying through this that every service can just simply cut and paste from others. It's about trying to identify where there is transferable learning and actually where there's not, and that's a perfectly legitimate place to get to.
Absolutely. And the point about tailored individual support is it's got to be tailored, and that generally means you need specialism in the needs of the client group you're working with. That's where the specialism comes in. I think what's probably common is in some of that approach to how do you enable people to talk about the difficult things they're facing in their lives, and then how do you set up a system that can effectively support them, and what do we know about finding those people, and what do we know about how long it takes to support them. That kind of stuff.
Okay, thanks very much. Annika, thanks very much for the question. Olivia, again, just go back to, you make the point about this isn't just for services which have got some lengthy technical evaluation which shows exactly what they've achieved. If people are joining, whether you're joining live or you're joining the recording afterwards, welcome if you are. If they don't even have a service up and running yet, does it still work? Are these sort of events still for them?
I think it's anyone who wants to come and kind of share, even if someone hasn't got something up and running, they probably have some learning that they can share. Presumably they've done some research, they've worked in similar services. If you've got something kind of practical to share and to learn from others as well, need to learn from others, that could still be useful for people to come.
So I suppose the message we're making more than anything else is if you're in that grey area of thinking, is it really for me, is it not? Probably the answer is yes.
Yeah, I would think we were saying, if you are still keen and enthusiastic to come, at this stage of the webinar, you probably should.
If you've managed to go through half an hour and you're still here.
You're passionate enough to come.
Excellent.
But I think it'd be a great opportunity as well to meet others working in this space. And I think, one of the things that's really interesting when I talk to loneliness organisations is often it's quite lonely work. Quite often they've been the only organisation working in their area or an issue that hasn't always been quite so well understood. So, it's great to kind of generate that community. And I think we're really keen to sort of have people that want to work together on this and share their learning and share their thinking and share the worries that they have, and see if we can come up with some simple answers to those questions that then we can share more widely afterwards.
Great, thank you very much. So again, I'll just remind people just how to get in touch. If you've got questions, comments, reflections, use the Ask Question feature, send us an email, or do tweet us. Again, if you're watching the recorded version later on, that Ask Question feature probably is going to be less useful. But please, of course, do feel free to get in touch by email or Twitter. You're very welcome to indeed. Olivia, you made a point about this isn't about seniority. And also, I think a really interesting one about sort of service user involvement. Service users absolutely welcome.
Yes, absolutely. I mean, I think service users would be more than welcome. I mean, who better can reflect on what's worked and what hasn't than the people experiencing the service. Of course, everyone is welcome. But yeah, service users, please come. Anyone, again, who has something kind of practical to share, learning, we want them there.
Great, okay. And what about commissioners, Kate? If you're working in a local authority, thinking about commissioning a service like this, is this the right place to get involved, or possibly there might be a point later on?
There'll probably be, I mean, to be honest, for commissioners, we're probably thinking towards the end of the programme, we've sewn some of these things together, there might be more of an opportunity then. We're probably going to bring people back together towards the end of the programme to share what we found and share those themes. But absolutely, depends how much intimate knowledge you have of your local services as to whether you're the right person to come along, and people can judge that for themselves. But I think the intention of the programme is to kind of make this very practical, have a really honest and open conversation, slightly warts and all, share our failures as well as our successes, and then we'll bring together the themes that come out of that, and then make sure we're packaging those in a way that's really digestible for funders, for commissioners, for policymakers, and whoever else needs to hear what we find.
So I think just so commissioners don't feel picked upon, let me say everyone else, you're welcome, commissioners, no. This is all going somewhere, isn't it? You mentioned the report in the summer. Do you want to talk a bit more about that?
Yeah, well, so the report will be pulling together what we kind of discover in the workshops, and we'll be reflecting on that in the summer. So there'll be a draft report, and we'll reflect on it with different experts and participants, and then bring that all together for a final report that will set out common threads and solutions, and I guess that's where, you know, the opportunity to drive it forward and to make sure it's disseminated across the country to whoever it would be useful to, that's the opportunity.
I mean, and the truth is, this is a real time of opportunity in loneliness because of the government's commitment to a strategy, because of the fact there was a commitment to funding, because of the fact that there's so much interest. I think, you know, it is a really good time to be making a case together about what works, what doesn't work, how to do this. Also, we know that lots more people are starting to be interested in setting up services. So I think we want to bring this together in a way that's really practical for people to understand what the key things they need to start with are. Yeah. Okay, great, good. Again, thank you, Kate. Thank you, Olivia. At the moment, please do send through questions and comments. Olivia, do you just want to remind us once again of the dates and how people can sign up?
So 20th of April, and just to make sure I get these right, 20th of April in Bristol, 27th in London, and 1st of May in Glasgow, 10 a.m. to 1 p.m. And the registration is open, and that link is somewhere on the PowerPoint as well. Yeah, perfect. Yep.
Thanks very much, Olivia. So, Nadia, thank you very much. Nadia saying, I find after the 12-week service, many who are not as mobile require a befriending service, but there's not sufficient people to cope with demand. Not everyone is then able to connect back to their community. Is this, Kate, one of the things which we really big challenge that I've heard from Community Connect programs, from some of the other programs that are working in this territory, that although I think a lot of services have an aspiration to connect people into more active services, for some people befriending is the most realistic option, and for some people it's all that they are ready to cope with at the end of the intervention phase, and there is a shortage of befriending services. However, I think there's probably more that can be done to connect up the different befriending offers, some of which are on the phone and some of which are in person, and try to kind of fill those gaps. But it is definitely a live issue, and sadly some befriending services are being decommissioned at present. So there's very much a live issue around, and I'm not surprised to hear it. And I think this is one of the areas where there's potential for advocacy messages to come out of this, as well as practical learning. Yeah, I think really strong point you made earlier about the link into policy.
Yeah, definitely. I mean, and so that is such a common issue, and like you guys have already touched on, the fact that sometimes the services just don't exist and there isn't enough capacity. So often we just don't know what's out there. Yes. There's so many great kind of local initiatives, yet nobody or not the right people know about it. So we've been doing some kind of actually some MPs who are sitting on the new all-party parliamentary group have been hosting events, bringing everyone in their local constituency who provides some of the services to come together to start mapping it.
Yes. Okay.
And you know, there are provisions under legislation for it to happen, but it probably doesn't happen enough to the standard that we need. So yeah, it's an exciting opportunity for that as well.
And so I think certainly part of the outcome of the learning events is that there's everything which will go into the report and the learning which will go forward. But we hope participants, if you can make it, if you can come along, we'll actually get a whole host of new connections. It might even be people in the same area where actually you didn't realise that both of you existed. So that might be one good thing which will come out of it, along with everything else. Question from Richard. Thank you, Richard. Saying it'd be interesting to look at how to run community connecting models in very diverse communities. Cultural differences can be a barrier to engagement. Will this be covered at events? Kate?
It'll be covered if you come along and raise it, definitely. No, I mean, seriously, really the agenda is up to the participants, really, and we will be open to any issues. But I think this is a critical issue that that kind of comes back to the point you made. There is no kind of out-of-the-box version of this. It's a very personalised service, but also from community to community, from client group to client group, there is a real need for sensitivity. And I think, you know, it's not simple, but I think we want to try and draw some of that out. So yes, please come along, please talk about your experiences, and definitely that's something to have on our radar.
Lovely. So I think the comments coming through are spot on in terms of those very practical issues which you're dealing with, and fingers crossed other people are also, well, we don't hope that people are having the same problems, but actually the ability to share learning across common issues is exactly what these events are here to do. Question or comment from George. Thank you, George. Saying, I love that your programme features co-developing a plan of activities to engage each person to achieve things they want. That sort of one-to-one conversation we're talking about. I'd be interested if there are any themes emerging from the goals which folks have set.
Well, do you?
Yeah, so I think it's probably not surprising that when we ask people what they want to be able to achieve, and this is across all of our health and social care related services, most people want to kind of get out and about, do kind of everyday tasks, but the one that comes out more often than not is maintain their relationships, and so they want to get out and about so that they can, you know, reconnect with their friends and family, or they want to be able to do daily tasks, even simple things like tidy their house, so that they feel like they can invite friends and family over. So it's often, you know, across the board, whether we're helping someone home from hospital after an injury or accident, or to a doctor's appointment. When we ask people what they want, it's usually, even if it's something quite practical or help with their health condition, it's so that they can be less lonely and feel more part of something, or carry out the activities and feel stimulated. And
Okay, and Kate, very much going back to your point about this is all about tailored support.
Absolutely. I mean, so when you ask people what they want, people talk about the things that matter to them. Now, it may be that in order to stay in touch with their friends and family, they need to better manage their health condition, or they need to address their benefits issues so that they've got enough money to travel, that kind of thing. There's a whole range of stuff that sits under there, but I think it's not surprising that humans talk about the day-to-day things of human life, you know, having family, having friends, having things to do with your time, and that's what people tend to want.
Excellent. Question from George, co-op member pioneer. Thanks very much for joining, George. Saying, how will this connect with British Red Cross community connectors, volunteers and others, e.g. Co-op member pioneers? For example, will community connectors be attending the workshops?
Yes, definitely. We're going to make sure that we've got community connectors from the Co-op and British Red Cross partnership at each of the events to share their own practical experiences and learning, and also use it as an opportunity to learn from others, just like everyone else. So short answer, yes.
Short answer, yes. That's a snappy answer to the question. And so this, again, going back to how you set out at the beginning, Olivia, the role of the British Red Cross here, that this is one part of a larger programme, but very much part of that programme, not sitting outside.
Oh yeah, definitely. So this, you know, it's a way to improve the 39 new community connecting services that Co-op have given us the money to start, but it's also a way to feed into the policy and practice solutions that we're developing with decision makers. across the board, whether that's commissioners, funders, or policymakers. So absolutely, it's to me, it seems one of the most useful and practical things that we can get immediate results almost. I'm hoping that we can leave these sessions, and at the end of the year we'll start implementing the learning that we've got out of them. So it's exciting.
Yes. Don't wait for the report to come out. Actually, if there's the shared learning which comes out of the event, great, fantastic. Kate, very techie question. Can more than one representative from a single organisation come to the events?
Yes, as long as you're happy with that. At some point your organisation is happy with that, then that'd be great. I mean, I think particularly if you can bring different perspectives, I think particularly, if some of you working different in areas or working in different parts of the programme, that would be fantastic, because I think the intention is that we'll do a lot of talking, we'll do a lot of sharing ideas and thinking, and I think even within one organisation there's often very different experiences and perspectives, and especially when so many of these services are delivered in very tight localities or very small client groups, there are these kind of differences that come out about what works and what people have found effective. So yeah, I'm happy if they're happy.
I think that diversity point, Kate's really well made. And so this whole concept of running shared learning events is something we do quite a lot at Kaleidoscope. And I think one of the things which we find quite often is that people sit on fantastic bits of practice, which actually it takes that comparison to realise it's actually fantastic. So we're certainly not expecting you to think, well, I've solved this, and everyone will be wowed when I tell them. In order to come along, and it's absolutely just about the mindset to share and be willing to learn from others. And I think we find this sort of event really valuable just for individuals themselves to actually realise, actually, I hadn't quite twigged that we do this bit really well. So that's, I think, certainly one of the positive outcomes we'd look to come through from the events. One more very techie question. Okay, do people have to attend the event nearest to them?
No, absolutely not. I mean, you're very welcome to attend the event nearest to you, but you're very welcome to attend whichever one is convenient to you. There's no sort of geographical limitations. They're just some locations to try and spread things out. And obviously, it'd be great if we could have one in every town, but time doesn't allow.
Every town learning event's not coming to quite yet. We're going to start with those three. Comment from Nazia. Thanks, Nazia. Just linking to that diversity question earlier from Richard, just saying, I've supported people of diverse backgrounds through building trust and relationships. Nazia, thanks very much. And a nice link actually to that central focus here, Olivia, of building trust. And one of the areas I'm sure we'll be looking to explore about how best you actually do that through an intervention like this.
And I think it goes back to these kind of, we call it the top three goals, asking someone what they want to be able to achieve by the end of our intervention. But many organisations have very similar approaches. So whether it's guided conversations or phrasing that question a little bit differently, at its basic terms, so really putting that, starting from that person and letting them know that you're here to help them to achieve what they want to achieve. But also, during those conversations, you naturally start to build up a rapport, and you get to know somebody. And if it's in their house, you might spot kind of simple clues into their kind of wider life that can help start that conversation. So whether it's a photo on the wall and you've just realised that person might be bereaved, and maybe that's what's kind of led them to the situation, to those feelings that they're currently feeling. All of that comes together to build this kind of trust and relationships, which I'm sure Nazia could talk to even better if she's doing that. But that's it. And I mean, we do here at the Red Cross that people use that word quite a lot. Trust. I really trust you to help me do, and I'm sure other people will get the same if they're using that approach. It helps.
Olivia, thanks very much. And just saying, so Kate, when we said we'll probably talk about these three themes, these, of course, aren't the only three things we could talk about. Why did you focus in particularly on these three?
To some extent, they're what comes through when you read the literature on some of the more long-established schemes in this area. To some extent, they're what comes through when you chat to people who are involved in these schemes. But I think, this is a programme with a beginning, middle and end, and we've got sort of three things that come to the beginning, middle and end of these kind of interventions. So I think it's probably worth us structuring I structure my thinking that way, certainly. And I think, you know, they are the places where things can go right or wrong, really. And so I think, but also the places where a lot of organisations spend a lot of time differentiating themselves, and sometimes it's useful to step back and say, well, what actually do we have in common?
Yeah.
And what is the reasoning behind those points of differentiation? So, yeah. But very open to you taking the conversation in a different direction, not you, Richard.
No,
You.
And again, if you're watching this later, you're not watching it live, and you're sitting going, I'm not quite sure if those are the right three. Again, do get in contact. So our email address again is hello@kaleidoscope.healthcare. We are very purposefully shaping these agendas around the topics which people want to talk about. So sort of we've been looking at the evidence, looking at the literature, thinking these probably are the right areas. If you disagree, please tell us, and we'll shape the agenda accordingly. A really nuts and bolts question from Vanessa. Thank you very much, Vanessa, saying, are expenses going to be paid? I should say that we are really keen that people are able to attend. And although there's not a sort of a huge pot for expenses, I think if you are struggling through whatever way to be able to attend, I think get in touch and have the conversation, and let's see what we can do. We are wanting as many diverse voices to attend as possibly can. So hopefully, Vanessa, that helps, and we hope to see you at an event. Just a reminder, again, we've got about 10 minutes or so left. So please do send through sort of anything here which you're thinking, yeah, that is spot on, or actually we should be doing things a bit different. Please do share that. Again, ask a question, use email or tweet. So Olivia, just a question in terms of there'll be these learning events. There'll be a report. Is there sort of what's sort of the British Red Cross long-term plan on loneliness? This is going to remain a big issue for you for beyond 2018.
So I think a few years ago we carried out some research, and we found out in our health and social care pre-existing before community connecting services, loneliness and social isolation were the two most common issues affecting our service users. Knowing how often it's that experience of loneliness that can tip somebody into further crisis, developing a health condition or an injury can create the circumstances that cause that person to feel lonely in the first place, but then that it cause and effect. It can make it worse, it can exasperate that crisis. So for us, it remains a big issue. We are providing the Loneliness Action Group and the Secretariat to the All-Party Parliamentary Group with the co-op for a year. But that doesn't mean the issue goes away for us after that.
It's solved, and then we move on.
Yeah, loneliness is because, like we said, it's such a subjective experience. Like all big issues, it only affects over 9 million people in the UK. They describe themselves as always or often lonely. This isn't a small issue, it's a complex issue. Yeah. And whilst we're making great strides this year in lots of different ways to tackle it, it's not going to be tackled. And loneliness is never going to go away because it is such a human feeling, but it's about how we can kind of facilitate a less lonely society and kind of prevent people from falling into that tipping point, chronic loneliness.
Lovely, thanks. And Ken, we touched briefly on the Joe Cox Commission earlier. How does this fit with everything which came out of the Commission's report?
Well, I think the heartening thing about the Commission's report is that it led to the commitment for a government strategy and a commitment to measuring loneliness, to improving the evidence base on loneliness, and to funding innovation and spread of initiatives. And I think there's bits of all of that this can really feed into, because I personally see those foundation services as absolutely critical in terms of making a real difference for people who are already lonely. There's lots that we can do in our community to try and prevent loneliness, to try and create a society that's more lonely. But before people who are experiencing that often or always lonely, chronic loneliness, we really do need these support services that can reach out to them, that can work with them to understand what's going on in their lives and can support them to make use of what else is available in the community. And I would be amazed if these services were not seen as quite a critical part of any strategy that goes forward. And I think what's really important is that we don't fixate on one particular version of those programs, but we recognise that type of program, that core of what's good, and it might be called social prescribing or local area coordination or whatever it is, community connecting, doesn't really matter. What's important is that we have a way of supporting people who experience chronic loneliness or at risk of experiencing chronic loneliness to come through.
So again, we've touched on this before. That's a really important point, that the purpose of this programme, the purpose of these events, are not to create a cookie cutter mould of what every service should look like.
Absolutely not.
Questions still coming through. Thank you very much indeed. How many people do we expect to attend at these events, Olivia?
Is it around 30 people at each event, or is it?
That's what we're planning for. They'll try to overwhelm us. I think
we would love to be overwhelmed. But yes, I think we're thinking about 30 or so, which would be great. Another question from Engaged and Robin, thank you very much. Saying, is the programme interested in hearing about our loneliness conversations research, learning from older people about the impact of loneliness and what solutions work for them?
Definitely.
Yeah, sounds great. I think we'll be interested in learning about that, in and outside of those workshops. So. Yeah.
And thanks very much for the question, really good one. That if there are bits of work which you're sitting on now and you want to share them with us, please do so. Don't feel you have to wait for the event, something wrong then. Our email address is just there. So we've talked a couple of times about this report, which is going to be being produced over the summer. That will be drawing in lots of different bits of input, which will come from the events and from evidence from elsewhere. So if you think there's anything which you'd like to share, send it through. Email address is just that.
And absolutely, we are going to draw on the body of literature that already exists around some of these schemes. With we have no intention of trying to reinvent this wheel. We just want to augment it with more of the practical learning, and I think more of the detail about the hows and the whats and the who's and the whens, really.
Yep, great. Question from Kate. Thank you very much, Kate. Saying, key issue to access this type of service is capacity of volunteers who deliver one-to-one support. The recruitment and retention of volunteers is also an issue. Would work with focus on people who have succeeded at this. Again, common issue, Kate.
Yeah, and not all of these models rely on volunteers, but many do. And particularly many rely on volunteers in terms of supporting people into their communities. Once their needs have been assessed and worked through, then volunteers work alongside people until they feel confident on their own. So yeah, volunteer recruitment and retention is potentially another key theme, because I think it is an issue that a lot of organisations are grappling with. And there's this, one of the big issues is the often mismatch of supply and demand in different areas, which is a tough nut to crack.
another issue to add to the long list. And that point, Olivia, about focusing on people who succeeded at this, certainly what we're trying to do through the events is showcase some people who've actually been doing this really well.
Yeah, of course. We want the good and the bad throughout. So
and the middle.
And the middle. I mean, a lot will probably be middle, but yeah, I mean, some of these issues people will inevitably have done it well somewhere, and we hope to attract some of those people. But
do drop us a line, because if you've got an example, if you think you've got the solution to one of those key challenges that we have faced, and you want to come and stimulate discussion by telling people about it, then do drop us a line, because we will obviously need to kind of have some inputs to these conversations. So if you think you've got the answer and you're willing to come and share it,
or even part of the answer. And we can piece it together in the events. So we're drawing to a close. We've got about 5 minutes left or so. And in a moment, I'll go around my panel. Thank you very much indeed for joining. And just ask for a key reflection from the conversation. But just to reiterate those key points again: 3 learning events, 20th of April in Bristol, 27th of April in London, 1st of May in Glasgow, and all of those are 10 till 1. I think there'll probably be caffeine provided before that, and might even be a sandwich afterwards. But 10 till 1 on those 3 dates. The link to go to is on your screens there, bit.ly/BRC Tackling Loneliness. We would very much love for you to join us there. The key characteristic of anyone we want to come to the events is that willingness to share and learn. Being part of these services, absolutely, but actually come being prepared to share and learn. And I think you'd have a really good session. Great. So a key reflection, one key reflection from our discussion. Kate, do you want to start?
I think this point about the fact that there's such a diversity of these services. There's a lot of tailoring within these services, and we need to bring that out, but also recognise the common threads too. And I think that'll be the tension that we'll be trying to hold through the programme.
Okay. Okay.
I mean, I'm just really pleased with how many people have just engaged even in this webinar, and we've got some new issues that haven't yet been identified, and I think even one or two solutions, suggested solutions. So I think it's made me even more excited for a very kind of practical event where we can all come together and learn and improve.
Lovely, thanks very much. I suppose the key reflection for me is, again, just to say that the diversity of points coming through, we've spent a fair amount of time planning, we've thought about some of the issues which are most likely to come up, but we are looking forward to being surprised at the events, because these are the sort of, this is the first time this sort of event has gone on, and we'd be lying if we said we knew exactly what are the issues which people are dealing with, or exactly where the solutions lie. So I think this is a really exciting agenda, and hope very much you can join us on it. So just to remind you again, please do sign up for those face-to-face events. The link is just there. Please also feel free to share that link if you're watching the recording of this webinar with any colleagues who you think it would be useful for them to see. We'd very much encourage that. And we look forward to seeing you in Bristol, London or Glasgow. Great. Thanks very much for joining, everyone. Thanks. Goodbye.